Yes, hello. Welcome everyone to our webinar this evening, Diabetes 101, Mastering the Essentials. Should you have any technical difficulties during our broadcast, there's a number at the bottom of your screen. You can call Citrix Support at 800-263-6317. We're so happy you could join us this evening. Our format includes a short presentation followed by an interactive discussion. To type in a question, use the questions section of the webinar toolbar. At the end, you'll have a chance to ask questions, and so we look forward to an interactive webinar. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes, so please consult your physician before making any changes to your current routine. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. We are so happy this evening that Michelle Dart is joining us. She is our webinar leader. And let's see. Oh, goodness. Hold on just 1 minute. For some reason, it will not pull up. I'm so sorry. Michelle Dart began her nursing career 26 years ago. She went on to get her master's degree and become a pediatric nurse practitioner. She has 20 years experience working with children and adults with diabetes. Michelle became a certified diabetes education and care specialist 17 years ago and has maintained her certification. Michelle has authored a nursing textbook, self-published diabetes-related books, and has been a contributing author for multiple publications, including Cecilia Health's blog. She fulfills her passion by coaching patients to make lifestyle changes that improve health and quality of life. Michelle has been with Cecilia Health since 2018. And this evening, she would like to support you in some basic self-management of diabetes and overall wellness. So we are very lucky and blessed this evening that Michelle Dart is going to share her knowledge with us. So Michelle, you may take it away.
Thank you. Hi, everybody. I'm just going to go over the agenda. Some of the things we'll discuss will be, what is diabetes and looking at a diabetes diagnosis, blood glucose monitoring, diabetes medication, looking at some of the diabetes complications and how do we prevent that, what to eat, looking at a diabetes eating pattern, and we'll have some time for some questions, answers, and sharing. Um, Now, the first question is, what is diabetes? And I think a lot of people have different myths, different things that they've heard diabetes is. Type 2 diabetes is one of the most common forms. The other type is type 1. But with type 2 diabetes, the body doesn't use insulin properly. The pancreas makes extra insulin, but eventually just can't keep up. When we think about what is insulin and why do we even need it, insulin is like a key that opens up those cells so we can use the food that we're eating. Um, when we have a problem with the insulin being used properly or don't have the right amount of insulin, the glucose can build up in the blood instead of going into those cells. And then we end up with these cells starving for energy. Um, we often can treat type 2 diabetes with lifestyle changes, oral medication. Sometimes we need insulin. Um, there are different ways of treating it, and what works for one person might not work for the next. Now, looking at the diagnosis, you can have diabetes, you can have prediabetes. Um, Looking at the A1C is the first thing that we often assess. The doctor might do an A1C test. And what is that really? That's going to be a 2 to 3 month average of how much extra sugar is in your system. So, looking at this diagram, to have diabetes, typically the A1C is going to be more than 6.5%. Now, somebody that might be told they have pre-diabetes, or we need to really start worrying about getting that diagnosis of diabetes, they might have an A1C anywhere from 5.7% to less than 6.5%. Now, somebody that doesn't have diabetes or pre-diabetes, we would anticipate their A1C to be less than 5.7%. Um, Another test that they look at to help come up with a diagnosis of diabetes is a fasting blood glucose. So, somebody that doesn't have diabetes, when they wake up first thing in the morning before anything goes in their mouth, they should have a blood sugar of less than 100 milligrams per deciliter. And that's like done by a finger stick. Somebody with prediabetes, they might have a blood sugar that's over 100, but less than 126 milligrams per deciliter. Somebody that has a diagnosis of diabetes, we're going to see that fasting blood glucose over 126 milligrams per deciliter. Now, another test that you might see done is an oral glucose tolerance test. Um, I'm not sure how often doctors are doing these anymore, but I know it is done at times to determine how is your body handling that extra sugar. So somebody without diabetes, if they were to do this oral glucose tolerance test where they drink a substance that has a significant amount of carbohydrates, after the test, they're going to have a blood sugar of less than 140. Somebody with prediabetes, after they've ingested that high carbohydrate drink, they're going to have a blood glucose between 140 up to a little bit below 200 milligrams per deciliter. Somebody that has active diabetes, we're going to see a blood glucose of over 200 after they've ingested that high carbohydrate drink. Now, the A1C, just look at that again, gives that picture of an average blood glucose, like I said, between 2 to 3 months. Sometimes we look at an estimated average glucose. It is in conjunction with the A1C, and that's just another way of looking at that average glucose 24 hours a day over that 3 month period. And it really includes some of those times where we might not get a finger stick check. Um, when we do that finger stick, it's that one moment in time. Looking at that A1C or estimated average glucose is getting a broader picture. It's getting those times that we aren't getting that finger stick. And we know that that blood glucose can fluctuate up and down throughout the day. So we want to see how are things going in between those finger sticks. Some of the benefits of checking that blood sugar, yeah, it is just that one moment in time. So it doesn't give us this broad of a picture of the A1C, but it will help give a good picture of the body's response to your diabetes care plan. Keeping that blood sugar in range can help prevent or delay complications. So we know checking in and seeing that our blood glucose is in range, we're we're taking steps to prevent and delay those complications. It's really important to monitor even more regularly if you're taking insulin, because we know insulin can cause the blood sugar to drop and have increased risk of low blood glucose. Um, if you're having a hard time controlling those blood glucose levels, monitoring at home is going to be especially important because that information you can share with your doctor to help figure out what is the best treatment plan for you. If you have low blood glucose without usual warning signs, so what we might call hypoglycemia unawareness, where we don't experience some of the typical symptoms of a low blood sugar, you'd want to be able to check in and see and be able to detect those low blood sugar levels um, when there aren't those signs. Now, also, we can have ketones from high blood glucose levels. So that's going to be important. If we are monitoring our blood sugar, we can detect when we need to check for ketones. And that might be a question we'll, cover a little bit later. Um, at what point do you need to check for ketones? Many blood glucose monitors will actually say check ketones when your blood sugar is at a certain level. So you might want to pay attention to your blood glucose monitor when you do a finger stick. If your blood sugar, I believe it's over, 250, you might see that your monitor will start saying, hey, check for ketones. Now, how and when to check your blood sugar? Well, we're going to want to always wash hands before testing. We don't often think about the fact that there could be something on our fingertips without even realizing it. We might have had a glass of juice and got a little bit on our fingertip. And if that's on the fingertip, when you do that test, it can affect the blood glucose reading. So we always wash hands before testing. You'll have your meter there. You'll insert that test strip. We use a lancing device, and you want to do it on the side of your fingertip. If you do it too close to the fingernail, that can be painful. Um, the very tip of the finger can also be a little bit more painful. So usually just the side of the fingertip is less uncomfortable and works good to get a good drop of blood. Once you've done that, the poke and got the drop of blood, you'll touch and hold the strip to that drop of blood. The strip absorbs that blood, and then the blood sugar level will appear on the display window of your meter. But when do we test? That's another great question. We typically want to check first thing in the morning before we've had anything to eat or drink to get that fasting blood glucose level. That's going to give us an idea, how is our body handling things overall? Does the body kind of readjust and start the day in a good range? And then as we get more food, the blood sugar levels go up? Or are we starting at a low level? Getting an idea where you're even starting your day can help decide where the rest of your day is going to go. Checking before a meal gives us an idea where we're at before we put that food in our mouth. And then when you do a 2 hour after the start of the meal, or what some people might call a 2 hour postprandial check, that's going to say, this is how well my body is handling that food. And that's going to give the doctor an indication about your medication and what's working and what's not working. It is a good idea to always ask your provider when and how often you should be checking your blood glucose because it is an individualized thing and not everybody needs to do first thing in the morning and before every single meal. Sometimes a doctor might say, let's do that first thing in the morning at fasting blood sugar. And then maybe before and 2 hours after your biggest meal, just to get an indication of how things are going with your oral medication or your insulin dosing. But again, having that conversation with your provider to see what's best for you is going to be important. Now, target ranges. So there are different ranges, and this is something that does change over time as far as recommendations. The American Diabetes Association does a lot of research and keeps up to date with, what are the best ranges? What are the goals so that we can have the best outcomes overall, fewer complications. So at this point, the most current recommendations that the American Diabetes Association has is for that blood sugar to be between 80 to 130 before a meal. Now, if you check your blood sugar 2 hours after the start of a meal, the goal would be for it to be less than 180. Again, you would want to ask your doctor what your personal targets should be, and this is going to be individualized based on how long you've had diabetes, your age, what other medical conditions you might have. Um, if you have any known cardiovascular disease or advanced microvascular conditions, if you have that hypoglycemia unawareness that I mentioned earlier, and again, there's other individual patient considerations. So definitely discuss with your provider what your personal goals should be, but understanding that these are the goals that the American Diabetes Association sets out because this is what they find does help to decrease those risks of long-term complications. Keeping a log is going to be important. Um, Things that you might want to record would be the date and time. This is when I did my test, what the blood sugar results are, and sometimes people will make little notes as far as meal details. Okay, I wasn't as hungry, so I ate less than typical. Or I was really hungry and I ate more than I usually do. Or this was a family gathering. So, we had more of a um, buffet style eating. So it was different than my normal somehow. You might want to make a note if there was exercise before this blood sugar reading. Feelings. I know a lot of times we don't even really think how feelings can impact that blood glucose reading. But let's say you're tired, you're stressed, shaky. How are you feeling physically or emotionally? Stress can have an impact on that blood sugar level. Um, and other physical symptoms could be having an impact on that blood sugar. There are different smartphone apps. People are using those a little more often instead of the little paper and pen log sheets because it's hard to always remember to grab that logbook when we're running out the door. But a lot of times people have their phone with them. So some of the apps that you might want to check out that people have found to be helpful might be My Sugar Diabetes Logbook, My Glucose Buddy, On Track Diabetes, Diabetes Tracker, Diabetic Connect, BG Monitor Diabetes. Those are just a few that might be worth looking into. Um, I know that each one is probably a little bit different, but they're typically quite easy to use. And people find that it's helpful to have it right there on their phone because they are less likely to forget that when they go to the doctor and want to share that information with their provider. Treating a low blood sugar, when this is something that can be quite challenging. Um, how is it best treated? It would be with eating or drinking 15 grams of carbohydrates, waiting about 15 minutes, rechecking that blood sugar. If that blood sugar remains less than 70 milligrams per deciliter, we would repeat that, have another 15 grams of carbohydrates of something that's fast acting. Um, Waiting another 15 minutes, and then rechecking that blood glucose again. We call this the rule of 15. So we can remember 15 grams of carbohydrates, waiting 15 minutes, rechecking that blood sugar. It can be challenging though, because a lot of people tell me how when they feel that low blood sugar, when they have those symptoms, they feel super hungry. So keeping it to 15 grams can be challenging for some people. But if you have more than 15 grams, sometimes we see that blood sugar rebound and go a lot higher than we want it to be. So we want to try really hard to stick to that 15 grams of carbs if possible. Once you have treated that low blood sugar, you do want to try to eat a meal or some kind of snack within an hour. And usually we want that to have some source of protein because that will help keep that blood sugar from dropping low again a little while later. Some examples of fast acting carbohydrates that have 15 grams of carbs is half a cup of fruit juice. Some people will have about half a can of regular soda. 8 gummy bears are lifesavers. And you think about that, that's a mouthful. Some people will have a tablespoon of sugar or jelly. Everybody finds something that works best for them. And you want something that is going to work fast. You want to think about what are things that you can carry with you pretty easy. So a lot of times people will carry the little juice boxes. The lifesavers are easy to carry, but again, that's a mouthful and takes some time to actually get into your system. We don't usually carry around a jar of jelly, but there are, other things. There are glucose tablets that are easy to carry. You would want to look at the instructions because sometimes they recommend 3, sometimes they recommend 4. It depends on the brand. So you do want to make sure you know the glucose tablets, how many they say would be a serving size. Now, looking at diabetes medication, um, again, this is going to be something that's going to be individualized based on what your doctor thinks is the best plan for you. Um, Oftentimes, we try to start out with managing through lifestyle changes. Not always easy, but some of these lifestyle changes can help normalize blood glucose levels just by having healthier eating, routine activity, so that our body uses that food in a more essential way. Sometimes we do need to add pills, insulin, or other injectable medications. Again, this is going to be more of a brief overview. We don't go into a lot of detail about specific medications, but understanding that there are different methods that we can treat with medication, such as the pills, insulin by injection, or by an insulin pump. And then there are other injectable medications that are more often used with type 2 diabetes than with type 1. Oh, there we go. So here's and looking at the insulin part of things, this is actually a naturally occurring hormone that is secreted by the pancreas. So to take insulin, it's really just replacing something our body naturally makes. So with type 1 diabetes, the body doesn't produce enough insulin. It's not it's an autoimmune process that stops the ability to produce enough. With type 2 diabetes, the body doesn't use the insulin properly, and sometimes it's not able to make enough to keep up with what the body needs. There are more than 20 types of insulin sold in the United States. Kind of crazy. But there are long acting types of insulin, which is what we call basal insulin, background insulin, because the body naturally releases little bits of insulin 24 hours a day. And then there is short acting insulin that somebody without diabetes, the body would release that insulin when there is food ingested. So this would be a short acting insulin that needs to be given at meal times to help the body to use that food. Injectable medications, this can affect the body's hormones to help lower the blood sugar. So it targets a different hormone than just the insulin. The oral therapy, so the tablets, the capsules, the oral medications really are only for people who have type 2 diabetes. People with type 1 really rely on the insulin by injection or insulin pumps. Um, the oral medications do work best if you're doing it with routine activity and a healthy, nutritious diet. It's usually most helpful for newly diagnosed. Helps to get a little bit faster control over those blood sugars, whereas just making those lifestyle changes can take more time. And we know how difficult it can be to make those changes. So sometimes starting right out with an oral medication can help get better control of those blood sugars faster. There really is no best pill. Sometimes we need to try a different type of pill or a combination of pills. And everybody, again, is going to be different. And sometimes we need to combine those oral medications with an insulin injection. So, again, talking with your provider is going to help figure out what is the best medication plan for you. Um, we know that we have to be concerned about long-term complications. We hear about different things as far as complications, but to break it down a little bit more, there's microvascular, so looking at the tiny blood vessels that are affected, or macrovascular, looking at the larger blood vessels. Microvascular, we're going to see more issues in the eyes, the kidneys, and the nerves. So when we look at the eyes, we are looking for development of retinopathy. Retinopathy is looking at those little blood vessels in the back of your eyes that sometimes they get weak and will start to leak blood. And that's really what they're looking for. If there's a complication, that's when we see that leaking of the blood and in the back of the eye, and a special eye doctor, an ophthalmologist who's trained to really look in your eye, they're going to detect that early. They can see where the vessels are weakening before they even start to leak. So you want to make sure that you're keeping up with those eye exams. Um, Another microvascular concern is with the kidneys. This is going to be what they call nephropathy. Your doctor should be monitoring your kidney function routinely. Um, they're going to be monitoring this through blood tests, and they can do it through urine tests. So they're looking for urine microalbumin. If you ever hear them mention that, they are looking to see if you have any sign of nephropathy or kidney damage. Another microvascular complication can affect your nerves. And so they're looking at, you've heard neuropathy before, likely. Uh, we see that high blood sugar can damage the coating that's around the nerves. And once that coating is damaged and those nerves are exposed, then we start having symptoms such as pain, burning, that prickly feeling, like when you feels like your foot fell asleep. So typically, we see those things can happen most often from your fingers working its way up, or your toes working its way up your foot. So you typically have your toes checked. Um, they're going to check your sensation to see if they're detecting any sign of neuropathy. But anytime you feel symptoms of pain, burning, tingling, numbness, those are things you'd want to report to your doctor, uh, because they'd want to then further evaluate for any possible neuropathy. Macrovascular complications, when we're looking at bigger blood vessels in our body, we're looking at cardiovascular disease or possible strokes. So these are the things that we definitely want to work to prevent or delay from occurring. Other things that we don't always think about so much as a complication of diabetes is depression or skin diseases, gum problems. We think about depression as a more of a mental health, a separate issue, but depression does go often hand in hand with diabetes. In fact, with a lot of chronic illnesses in general, there's a grieving process that goes with a diagnosis of a chronic problem such as diabetes. And that grieving can contribute to a bigger picture of depression. So feelings of sadness, despair, losing interest in things that you might have enjoyed previously are definitely worth mentioning to your doctor so that you can have further evaluation and address that as a separate issue that can be hopefully treated um, with either counseling or medication, but it's something you don't want to avoid that discussion. I know a lot of times we don't want to talk about mental health, but it is important to discuss that with your doctor as well. Skin disease. A lot of times we don't even realize that there are different like skin problems that can go along with diabetes. It's not just dry, cracked skin, but that is one of the things that we often think about. That the feet can get very dry and crack open, but there are other rashes that can be connected with diabetes. So any skin concerns is worth mentioning to your doctor. Gum problems. We don't always think about the dentist as being part of our diabetes care team, but it is so important to keep up with dental care. Elevated blood sugars increases sugar in your saliva, so it can increase cavities. It can increase risk of gum problems, gum infections. Um, think about yeast infection because of extra sugar in the system. We can see yeast affect our mouth and our skin. So anything that is out of your ordinary is worth mentioning to your doctor to further evaluate as a potential complication. And how do we prevent complications? You know, blood sugar control is going to be your first line of prevention. Um, Having that A1C checked every 3 to 6 months just to help you keep in mind where you're at. If we don't even know where we're at, we're not sure what we have to work on. The goal of A1C less than 7 for most people, again, you want to make sure you talk with your doctor for your personal goal, but knowing where you're at and having that checked every 3 to 6 months is going to help you to stay on target and keep that blood sugar under control and ultimately prevent some of those complications. Regular checkups, seeing that doctor every 3 to 6 months and getting that A1C done at the same time is going to be important. They should be checking your feet for sensation and circulation, checking that blood pressure, your weight. We encourage those annual eye exams so that they can get a look at those blood vessels in the back of your eyes. If you smoke, of course, we would encourage people to stop smoking because that also increases the risk of cardiovascular disease. Cholesterol control. With the doctor or nurse practitioner, your healthcare provider should be doing regular lab checks on cholesterol. Um, some people do require dietary changes to improve cholesterol, and some people require medication to help keep that under control. Again, that would be something that you would discuss with your doctor based on your personal lab results. The blood pressure control. Uh, the blood pressure control. So some doctors will actually uh, put you on a blood pressure medication to help protect your kidneys because high blood pressure can contribute to that kidney damage as well. So, you might want to make sure you understand why you're on a blood pressure medication. Is this to help just as a preventive to help protect my kidneys, or is it because my blood pressure is elevated and needs to be treated? Looking at nutrition, this can be overwhelming. I think it is one of the most overwhelming pieces of treating diabetes. And what can we eat? It is the carbohydrates that we're really looking at. Now, consistent carbohydrates at meal and snack times can help to um, keep things under control because then you can see what patterns you have, and the doctor can take a look at your blood glucose levels and see how are you responding to this consistent carbohydrate intake, and then help decide what's the best treatment for that. It can be hard to keep it consistent. The amount per meal can vary with the individual needs. Sometimes our appetite isn't as consistent to keep it with the same amount of carbohydrates at each meal and snack. The plate method, I'm not sure if you've heard about the plate method, but it's a common way to try to keep portion control. So we would take that plate and separate it into sections. Half that plate should be your vegetables. A quarter of your plate would be your carbohydrates. And then the other quarter of the plate would be your protein, like your meat. It is important to meet with a registered dietitian to help look at what your personal meal plan might need to look like. Um, there is www.eatright.org is a resource where you can enter your zip code and you can find a registered dietitian in your area. Now, we could also look at the American Diabetes Association has a great information section on nutrition. So you would go to www.diabetes.org. They can, you know, help you to create a plate so you can mix match things to see, what would be some good ideas to create different meals so that I have a variety, but I'm still keeping things under control with a good, healthy variety of foods. Um, in looking at the nutrition part, before we go to the questions, I do want to say that that portion size is a big key to keeping things under control. When we're looking at the serving size and what is recommended, sometimes it's overwhelming because it's like, that is so little. I'm going to be really hungry if I eat that particular portion size. So when we're trying to decrease our portion size, I say start with what you normally would eat. Create your plate like you normally would and take 1 spoon of each food off of the plate, and there you've decreased the portion size and it's not overwhelming and you won't feel like you're starving. Then the next time you eat, gradually take a little bit more off the plate until you get to that recommended serving size. Um, I think that helps the body to get used to the smaller portions than what we typically eat. And it's less overwhelming and it's just a little bit easier. Now, I do want to take time for any questions. I'm just trying to look to see if we have any questions here. Um, Anybody have any questions they want to ask? So I'm not seeing any on the board here. Feel free to put any questions out there if you have some. One of the things that I was, thinking about was how it can be overwhelming when you're first diagnosed and you've got all this variety of information. And what we covered right now was just little bits of a lot of stuff. And there is a lot more information out there, and using the tools that you have to get more information about the topics that are particularly interesting to you or areas where you feel the most challenged and you want more information, I always encourage people to use the American Diabetes Association as a resource. Their website has so much information. Um, Use your diabetes coach. Your diabetes coach can help you to decide, where do I even start? Here they're telling me I need to take this medication, I need to change my eating, I need to get some exercise. I'm not even sure where to start. Your diabetes coach can help you to figure out one small step that gets you closer to where you need to be. And once you take that first step and you find, okay, I can handle this part, then you can work on the next step. You don't have to tackle it all at once. Otherwise, it does feel really overwhelming. But one small change is going to make a big difference. It could be as simple as, while you're watching TV, grab a couple cans of soup and do some arm lifts. Every movement's going to count. Do some leg lifts. Again, every movement's going to count. Even if you're not tackling a big exercise routine or going to the gym, every movement's going to count. Um, if you're overwhelmed by the nutrition part of things and don't know where to start or how to even really look at those food labels, talk with your diabetes coach, talk with your provider. Um, your doctor may have a diabetes educator in their office. Talk with the registered dietitian. Help me look at that food label to figure out, what do I even need to be paying attention to? We say, I told you about the carbohydrates, but there's a lot of other important pieces of that food label that can be helpful. Just looking, and I'm not seeing any other questions. And it's getting to be about 6:45. Um, Last call. Any questions from anybody? It's really been great doing this with you. I have a little bit more here. Um, Let's see. So we do have other live events that are going to be coming up. And if any of these are interesting to you, let your diabetes coach know. And they can also send you a schedule about some, other topics that will be coming up. November 8th at 5 o'clock Eastern Standard Time. I'm going to be looking at embracing the holidays without deprivation, healthy eating strategies for every festive eater. We know holidays can be a challenging time to stick with eating healthy. So this might be a great topic if you're worried about going into this holiday season and being able to stick to your goals. Um, and then it looks like in December 15th, at 6 p.m. Eastern Standard, there's going to be a webinar about taking control, inspiring tools and tips for becoming your own diabetes coach. It's great to have somebody that you can talk with, but sometimes we have to be our own inspiration. And this is going to be a great one if you feel like, you know what, I do. I need to take control and inspire myself, and this might be, the one for you. So don't hesitate to, sign up for any other live events that look like they might be helpful for you. And if you need any more support, again, you can ask your coach. And um, if you haven't signed up for text messages, ask your coach about that. And then Facebook does have Cecilia Health personalized diabetes coaching, where you can get some other diabetes information and tips. So all kinds of sources of support out there for you. We really appreciate you joining us today. Thank you.